Welcome everybody to our Healthy at Home Tuesdays webinar. Today we are going to be doing a conversation about Medicare 101, the basics of Medicare. And our guest speaker today is Deborah Gardner. Deborah has worked for Salt Lake County for 12 years in various positions. Currently, she is a Medicare Options Coordinator for Aging and Adult Services. She has a bachelor's of integrated studies in nutrition education, health promotion, and health administrative services, and a master's degree in health administration. Deborah loves working with older adults and finds her work engaging and challenging, and most of all, rewarding. So with that introduction, I am going to turn the time over to Deborah to let her tell us all about Medicare.
Thank you so much, Annie. I'm excited to be here today. As she mentioned, I have been, working for Salt Lake County for a number of years, and recently started working in Salt Lake County with Salt Lake County Aging and Adult Services, and this has just been just one of the funnest jobs that I've worked in, and probably one of the most rewarding. I truly enjoy what I do, and Medicare is very complex, and so I'm hoping that the information that I share with you today, that you'll walk away feeling a little less intimidated about Medicare, and just learn some great information that will help you to make an informed decision when you are ready to enroll in Medicare. So we'll go ahead and get started. If you have questions, you can certainly feel free to ask the questions. If we're running short on time, then I will probably ask that you hold your questions until the end of the presentation, and I will try my best to answer the questions for you. As I mentioned, Medicare is complex, and there are some things that I'm still learning. So if I don't know the answer, I will certainly tell you that, and follow up with you, get the answer and follow up with you. So with that, I'm going to go ahead and start. I'm going to share my screen. Okay. Perfect. Is everyone able to see the screen okay?
We're not seeing it pulled up yet.
Okay.
There we go.
Okay, perfect. All right, so let's start out by talking about what is Medicare. So I'm going to just kind of do a brief overview of what Medicare is. So Medicare, it's a federally funded program. Medicare is a federal health insurance program that is funded by the federal government, and it is available to individuals who are over the age of 65 and who have earned enough work credits. So you have to have sufficient work credits in order to enroll in Medicare. Now, for individuals who have not earned sufficient work credits, you can still apply for Medicare. However, there is a cost for Part A, which is typically free. So again, it's available to individuals 65 years of age and older who have sufficient work credits, disabled individuals who are currently receiving SSDI payments. So if you are deemed disabled and have been receiving SSDI payments for 24 months, you are eligible, then become eligible for Medicare. And individuals with end-stage renal disease, or ESRD, are also eligible for Medicare, regardless of their age and the number of work credits that they have. And ALS, Lou Gehrig's disease, if you've been diagnosed with Lou Gehrig's disease, you're also eligible for Medicare. Some of the components of Medicare, and we're gonna dive into that a little bit deeper, but Part A, Part B, and Part D are all components of Medicare, original Medicare, and we're gonna talk a little bit about the difference between or the two different types of Medicare. Okay, so original Medicare is comprised of Part A, Part B, and Part D. Part A is hospitalizations. Part A covers things like hospitalizations, home health care, skilled nursing care, and hospice care. If you have a hospitalization, you're admitted to a skilled nursing facility, those services will be covered under your Part A benefits. Part B is often times referred to as medical insurance, and it covers things like your doctor's visits, outpatient services. So if you have an outpatient procedure, outpatient surgery, it would be covered under Part B. Home health services are also covered under Part B, and durable medical equipment. Now you'll see that home health services are covered under Part A and Part B. Part B home health services are usually for individuals who are homebound, regardless of whether they've had a recent surgery or a severe illness, an acute illness. So people who are homebound and unable to leave their homes oftentimes will qualify for home health services under Part B as opposed to Part A, which is usually when you have an acute illness and you're recovering from that illness. Part D is a standalone prescription drug plan. It's provided or offered by private health insurance companies, and it covers things like self-administered drugs. So if you take, for example, a blood pressure medication or other medications prescribed by your doctor, and you can self-administer the drug, then it will be covered under Part D. Excuse me. Part D does not cover over-the-counter drugs or supplements. So if you, things like Tylenol, pain medications, over-the-counter pain medications, or supplements, vitamins, are not covered under Part D. Okay, so this is original Medicare, and original Medicare is just one way that you can receive your Medicare benefits. Some of the disadvantages of original Medicare are that there's no yearly limit. So there's no maximum out-of-pocket cost for services. For an example, if you have a surgery and the cost of your hospitalization, you're hospitalized, and the cost of your hospitalization, let's say, was, for example, $100,000, and that was Medicare's contracted approved amount. Medicare would pay 80% of your hospital cost. You are responsible for 20%. So there's no yearly limit, and each hospitalization you would pay your co-insurance and deductible. Medicare would pay its portion. So there's no yearly limit or no maximum out-of-pocket cost with original Medicare. Original Medicare also excludes dental, vision, and hearing benefits. And if that's something that's really important to you, original Medicare again does not offer those extra benefits. Some of the benefits, though, of Original Medicare is that you have a large network of providers that you can choose from, so you're not restricted to using providers within a small network. You can see any provider anywhere in the United States as long as they accept Medicare. You can also purchase a Medigap plan that will help you with your deductibles, co-payments, etc. Medigap plans are supplemental plans. They're not secondary insurance plans, but they're supplemental plans that will help supplement the cost of that Medicare leaves behind. So whatever Medicare doesn't cover, your Medigap or supplemental coverage will pay. Okay. So Medicare Advantage plans, there are several types of Medicare Advantage plans. Medicare Advantage plans are, it's just a different way of getting your Medicare benefits. The federal government, Medicare pays private companies to manage these Medicare Advantage plans. And there are several types of Advantage plans that you can choose from. Again, this is just another way of getting your Medicare benefits. Some people refer to Medicare Advantage as all-in-one plans or bundled plans. And what that just simply means is your Part A, your Part B, and Part D are usually are bundled and provided by the same insurance company. So you don't have to look for a separate part insurance for your Part D. It's all provided by the same company, insurance company. There are different types of Medicare Advantage plans. HMOs are your managed care plans, and these plans are usually they're usually the most restrictive. So you have to see providers in their network, and oftentimes they require that you get a referral or have prior authorizations before you can have a service, or before they will pay for certain prescription drug cost. Preferred Provider Organization at PPO is also a managed care plan, but it offers a little bit more flexibility in that there are in and out of network benefits. So if you have a provider that's out of network, you can oftentimes continue to see that provider. However, there are higher costs associated with seeing providers out of network. Another Medicare Advantage plan is a special needs program or plan. In order to be enrolled in a special needs plan, you must have a specific disease or a healthcare need. Oftentimes you'll find special needs plans for people who have diabetes, cancer, autoimmune conditions. So you have to have a specific disease or condition that will allow you to enroll in a special needs plan. You must oftentimes, well, there's also a special needs plan that's available for individuals who have Medicare and Medicaid. This is called a dual eligible special needs plan, and it is only available to people who are on Medicare and Medicaid. All special needs plans must provide drug coverage, and understandably so, individuals who are on these plans typically have health challenges, health issues, and most of them are taking medications. And so Medicare drug coverage is a requirement for a company. If they're going to offer a special needs program, they have to offer drug coverage.
Hey, Deborah,
Yes.
I have someone posted a question in the chat box. They're asking, what about a person with epilepsy?
Okay. I know that there are several special needs plans. Let me just quickly check to see if there is a special needs plan for someone with epilepsy. I know there's quite a few. I can just quickly look. Bear with me. Okay, so I don't see it right off that is one that has that offers a special needs, if you have that particular condition. However, that doesn't mean that they don't have special needs plans for people with epilepsy. What you would want to do is call, if there's a plan that you're interested in, for example, Blue Cross, Blue Shield, or Aetna, you would want to call the insurance company and ask them if they have a special needs plan for individuals who have epilepsy, and see if they do offer, it's called a SNP or a DSNP. Now, if that individual is on Medicaid, so if the person who has epilepsy is on Medicaid, they automatically qualify for what's called a dual eligible special needs plan because they have both Medicare and Medicaid. Okay, hopefully that answers the question. Okay, so other benefits that are offered by Medicare Advantage plans. Oftentimes they offer dental coverage, both preventative and comprehensive. The plans, it varies from plan to plan. Some Medicare Advantage plans offer $1,500 dental coverage with a maximum allowable expense of $1,500. Some offer more, I've seen them as high as $2,000 or $3,000 for both preventative and comprehensive care. Vision is often one of the benefits that are provided by Medicare Advantage plans, as well as hearing. Okay, so this is oftentimes what attracts people to Medicare Advantage plans, is that they have these extra benefits that are excluded from original Medicare. Okay. So many of you have probably heard of a Medigap plan. We just talked about it a little bit, but Medigap plans can only be purchased if you have original Medicare. It's actually illegal to buy a Medigap plan if you have a Medicare Advantage plan. So Medigap is only available to individuals who are enrolled in original Medicare. As I mentioned earlier, it is not secondary insurance. So if original Medicare does not cover the service, the Medigap plan will not cover the service. So it's not like Medicare denies the service and the Medigap will pay for it. Again, it's a supplemental plan. So if Medicare denies it, your Medigap plan will also deny it. If Medicare covers it, the Medigap plan will also cover it. Okay. This plan, Medigap plans, as I said, only cover services that Medicare covers. They will pay things like your co-payments, deductibles, and co-insurance. The best way to think about it is Medigap. It fills in the gaps that are left behind by Medicare. Okay, again, it's supplemental coverage and designed to pay what Medicare does not cover. If you are under the age of 65 in Utah and you are, for example, disabled receiving Medicare, Medigap plans are not available to you in the state of Utah if you're under the age of 65. You have to be 65 and older in order to qualify for a Medigap plan. You may have heard of the term guarantee issue right. What that simply means is when you turn 65 and you are enrolling in a Medicare Advantage, a Medigap plan, you can enroll in that plan without having to undergo medical underwriting. So you're 65, you're enrolling in Medicare, and you want a Medigap plan. You can enroll in that plan and not be subject to medical underwriting. If you leave your Medigap plan, let's say you decide to go with a Medicare Advantage plan and you're gone for 5 years, and you decide that you, at age 70, you want to re-enroll in original Medicare and a Medigap plan, unless you have some type of a loss of coverage. So unless the plan says, hey, we're not going to cover Utah anymore, or whatever the reason they decide that they're going to discontinue the plan, if you just decide to leave and want to go with a different, come back to original Medicare after being on a Medicare Advantage plan for 5 years, or let's say, then you would be subject to medical underwriting. So I advise people that when you're on a Medigap plan, it's a really good idea to stay with them. If you choose to go with a Medicare Advantage plan, you have 1 year that you can return to original Medicare and not be subject to medical underwriting. If it's longer than a year and you want to go back to a Medigap plan, they will take into consideration things like pre-existing conditions and your health status at that time. Okay. You can purchase a Medigap plan beginning 6 months, beginning with the month that you turn 65. And again, you can also purchase a Medigap plan within 63 days of losing certain types of coverage. So if your plan informs you that they're no longer going to be servicing Utah, that's a qualifying event that would allow you to, to switch to another Medigap plan, or to go back, go to to enroll in a Medigap plan, or re-enroll or enroll in a different plan, I should say. Okay, so you have to have some type of a loss of coverage in order to find a different plan, or if you're not in a plan, in order to enroll in a plan. Okay. You would just simply enroll in a Medigap plan by contacting the insurance company that offers the plan. You can go to Medicare.gov. They have a great tool. You can just enter your information. It does ask questions like your your age, are you a smoker? And I think zip code, I think, is the other question, but it will actually pull up plans for you, and then you can call the plans and find out more about their premiums and what benefits they offer.
Hey, Deborah, I've got a
Uh-huh.
question for you from the chat box.
Okay.
They're asking, if an Advantage plan does not cover drugs, am I required to sign up for Part D directly with Medicare? What if I am low income but do not qualify for Medicaid and only need one generic prescription that costs $4 per month? Am I still required to pay for the Part D plan?
Okay. So if you enroll in a Medicare Advantage plan that does not offer Part D, as in Deborah, so if you're enrolled in it, you cannot you cannot find a standalone prescription drug plan. So if you're currently enrolled in I believe it's a TPO and an HMO that does not have drug coverage, the plan, you're not allowed to purchase a separate prescription drug plan. Most Advantage plans offer a prescription drug coverage, and oftentimes they do not charge a premium for those plans. Okay, so the best thing really to do is to find a Medicare Advantage plan that offers drug coverage. If you decide not to enroll in a prescription drug plan, but you are eligible. So for example, if you're in a Medicare Advantage plan that does not offer it, and you can't go and get a prescription drug plan, then you're not going to be subject to late enrollment penalties. But if you're on, for example, original Medicare and you are eligible for a Part D plan and you fail to enroll just because you say, well, I'm not taking any medications, I'll delay my enrollment until, maybe I start taking more medications. At that particular time, you would be subject to late enrollment penalties. So the best thing to do is to find a plan that has Part D included. And if you don't utilize the coverage, oftentimes there's no cost to enroll in Part D. It's just part of the plan, right?
Does that enrollment period, is that annually or is that the enrollment at the very first time that you join Medicare?
So during your initial enrollment period, you can, and we're talking about a Medicare Advantage plan? Okay, so during your initial enrollment period, you can enroll in a Medicare Advantage plan. Let's say that you get one that doesn't have drug coverage, and they won't allow you to buy a separate or a standalone plan. You would have to wait until open enrollment to switch to another Medicare Advantage plan that offers prescription drug cost, or to switch to original Medicare and purchase a standalone Part D prescription drug plan. There's also a period from January 1st to March 31st, which is called a Medicare open enrollment period, in which you can switch from a Medicare Advantage plan to another Medicare Advantage plan or back to original Medicare. Okay, so I guess just really when you're selecting your plans, just really be careful that you are selecting a plan with Part D in it, because if you get in an HMO or a PPO that doesn't have drug coverage, you're going to be stuck in that plan for at least a year with no drug coverage, and you can't purchase a standalone plan. Okay. I hope that answers the question. So that's really what I would recommend, is to be very careful when selecting your MA plans, that it comes with drug coverage. That way you're not, with a year without being able to buy a standalone plan. Okay. Any other questions? It's a little tricky for sure. All right. Medicare savings programs. So this is probably the most complex for me anyway when studying, learning about Medicare. Medicare savings plans are they are run by, they're Medicaid run programs, and they assist people with premiums, with their Part B premiums, and depending on the plan, the Medicare savings program that you qualify for, you can also get help with your Part D, as in David or drugs, premium as well. They assist with cost sharing expenses like co-payments, deductibles, and co-insurance. When you qualify for Medicaid, you are automatically enrolled in what's called a Medicare savings program, and there's several. The one that comes to mind that I've seen most frequently is called QMB. It's called Qualified Medicare Beneficiary. And so when you become eligible for Medicaid, you will automatically be enrolled in a Medicare savings program. You will also be enrolled in what's called Extra Help, which is a federally funded program that pays your Part D premium and prescription drug cost. So people who are on Medicaid and they fall below a certain, the federal poverty limit, they qualify for full Medicaid, and with full Medicaid, they get their premiums paid, their Part B and Part D premiums paid. For people who are just above the federal poverty level, they can apply directly through the Social Security Administration for a program, again, called Extra Help, and receive assistance with their prescription drug cost. Okay. Medicare, these are, again, Medicare run programs. There's several Medicare savings plan programs, but you have to meet the income and asset limits in order to qualify for these programs. Okay. Oftentimes, the people that qualify are the older adults, people with chronic health conditions, and of course, people with limited resources, limited income. Okay, so if you are on Medicare or you know someone who's on Medicare and they're really struggling to pay their premiums each month, and they don't, after they pay their premiums, they don't have enough for food or necessity, they should really consider applying for Medicaid. And if they're approved, Medicaid will automatically enroll them in a Medicare savings program so that they can receive assistance with those premiums and co-payments and deductibles. Okay. I did list phone numbers here if you're interested for Medicaid, Medicare, and the Social Security Administration. Give you a minute to jot that down. Okay. All right. If you're still working, and I get this question a lot, people will ask me, well, I'm turning 65. I'm going to continue to work for the next 4 years. What do I do? The most important thing is that you contact the Social Security office and at least get enrolled in Part A. Now, you can delay your enrollment in Part B, as in boy, and Part D if you still have coverage through your current employer. So as long as your current employer is providing what we would call creditable coverage, you can delay your enrollment in Part B and Part D. Okay. COBRA is not active coverage. So if you've been laid off and your employer says, I'm going to pay for you to have COBRA for the next 2 years, and you fail to enroll in Medicare, thinking, well, I've got COBRA, you will face late enrollment penalties. COBRA is not active coverage. It has to be employer-based, employer-sponsored insurance to be considered active coverage. Now, there are some other coverages that are considered creditable and active, and for the sake of time, I won't have, really go into those. But you need to make sure that if you delay enrollment in Part B and Part D, that when you get ready to enroll, that you can show the Social Security Administration that you've had coverage through, for example, your employer, and that the coverage was creditable. Okay, if you cannot prove that, you're going to be subject to late enrollment penalties. Okay. A late enrollment penalty is a penalty that occurs when individuals who do not enroll in Medicare when they're first eligible and are not enrolled in an employer-sponsored health plan. So just make sure if you're planning on working past the age of 65 and you're going to delay your enrollment in Medicare Part B and D, that you can provide to Social Security when it's time, when you retire, creditable coverage in order to avoid late enrollment penalties. Retirement. Again, just to kind of reiterate, you may delay your enrollment in Part B and D until you retire. Once you're retired, enroll in Part B within 8 months of losing your health coverage. So when your coverage stops, you're retired and your coverage stops through your employer, you have exactly 8 months to get enrolled in Part B. If you pass that window, then you will be subject to late enrollment penalties. Medicare is always, if your employer, you're going to end up having retiree insurance. Medicare is always primary and retiree insurance is always secondary. Okay. If you delay enrollment in Part D, you have 63 days from the date that you lose coverage to get enrolled to find a prescription drug plan. If you, again, go past that 63-day window, you'll be subject to late enrollment penalties. Okay, so it's really important once you retire. If you have retiree insurance, that's great. Medicare is going to pay primary. Your retiree insurance will be secondary. But it's important to remember that you only have 8 months to get enrolled in Part B when you lose coverage through your employer, and only 63 days to enroll in Part D once you lose coverage. Health savings account. Now, this particular part of Medicare is very confusing. I'm not going to go into it too much, and I would say that if you have further questions, reach out to your benefit specialist at your employer. You can contact the Internal Revenue Service. Health savings accounts are really tricky, but you have to stop contributing within six months before you retire. So if you have a retirement date, 6 months prior to that retirement date, you need to discontinue contributing to your HSA. Okay. One of the reasons is that in order to have pre-taxed contributions, you can only have one insurance. And if you're enrolled in Part A, you technically have insurance, and so you have to discontinue contributing to your HSA 6 months before you retire. You can, however, use the funds that are currently in your HSA to purchase approved medical devices or use it for approved services, but you have to discontinue contributing 6 months before your retirement date. Okay, for more specifics on that, there are some exceptions. And for those, you'll want to reach out to your benefits specialist, your HR department. There are, as I said, some exceptions to this rule.
Hey, Deborah, I have a question on that.
Yes.
So on your HSA, if you're contributing to one, from what I understood you saying, you have to stop contributing 6 months before you retire.
Mm-hmm.
But the funds are yours and you can use them after that, right? They're
You
like,
can use the funds for approved, just like when you were using while you were contributing, but you have to stop contributing to the HSA account 6 months prior to your retirement date.
well, this would be a good reason to max out your limit every year.
Absolutely.
Okay, thank you.
Exactly. You're welcome. Hey, retired military. So individuals who are in the military, they oftentimes get a healthcare which is called TRICARE for Life. And you must sign up, you must be enrolled in Part A and B in order to maintain your TRICARE for Life benefits. If you disenroll in Medicare, you will lose your TRICARE for Life benefits. Okay. The TRICARE for Life is really tricky. There's a lot of nuances here. And so I tell people to really meet with your HR department, because in some cases, some people decide that they don't want to enroll in TRICARE. I'm sorry, in Medicare, and they just want TRICARE to be primary. And then they decide 6 years later, no, I want to enroll in Medicare. You're not given a special enrollment period. So you really need to make sure if you're declining Medicare and sticking with TRICARE for Life, that you don't have any intentions to go back to Medicare, because if you do, 6 years down the road and you say, well, I have TRICARE for Life, but I want to get enrolled in Medicare, or for some reason your TRICARE for Life ends, you are going to be subject to late enrollment penalties. Okay. And if you disenroll in Medicare, then you will lose your TRICARE for Life. So this one's really tricky. I encourage you to talk to your HR division, or I'm sorry, the military, whoever it is that you consult with, before you pass up or disenroll or not enroll in something. Okay. Veterans benefits do not coordinate with Medicare. So if you have VA benefits and then you have Medicare, and you need to, if you're going to utilize your VA benefits, you need to be seen at clinics and hospitals that accept VA benefits. And if you're going to use your Medicare, you need to be seen at hospitals or clinics or use providers that accept Medicare. Medicare and VA benefits there's no coordination of benefit with these programs. Okay, the VA will pay for what it pays for. It wants you to be seen at their facilities. Medicare, you need to be seen at facilities that accept Medicare, right? There's no coordination of benefit. In other words, if Medicare would pay a certain portion and the VA would pay the rest of it, it doesn't work that way. There's no coordination of benefits with these two federal programs. Okay. Oftentimes people who have VA benefits will not enroll in Part D because the veterans, their veterans benefits are considered creditable drug coverage, and they get really, really good benefits coverage for their drugs under the VA. And so you'll see oftentimes that VA veterans will not enroll in Part D, Medicare Part D, because of how good their benefits are through the VA. Okay. Veterans should enroll in Medicare when they're first eligible. They will not be granted a special enrollment period if they delay enrollment in Medicare. So you say, hey, I've got VA benefits, I'm not going to enroll in Medicare, and then you decide later on that you want to, you will incur late enrollment penalties. So sign up when you're first eligible. Okay, we've talked a lot about late enrollment penalties. Time is kind of getting away from me here. So again, late enrollment penalties, avoid them by enrolling in Medicare when you're first eligible, enroll in Part B within 8 months of losing coverage, and enroll in Part D within 63 days of losing credible drug coverage. There are circumstances in which LEPs can be eliminated if you qualify for Medicaid or extra help. So if you are approved for Medicaid and enrolled in a Medicare savings program, your late enrollment penalties will be eliminated. If you apply for extra help through the Social Security Administration to get help with your Part D premiums, and you have Part D late enrollment penalties, those penalties will be eliminated. So those are really the two times, or when you can get help with your late enrollment penalties, or when they can be eliminated. You can also appeal a late enrollment penalty, but you have to show good cause as to why you did not enroll when you were first eligible. It's got to be extenuating circumstances in order for Medicare to consider approving or waiving your late enrollment fees. Okay. Open enrollment, it begins October 15th through December 7th. You can switch from original Medicare to a Medicare Advantage plan. You can switch from a Medicare Advantage plan to original Medicare, and you can sign up for Part D for the first time. Okay, this is what you can do during open enrollment. It starts October 15th and it ends December 7th. Okay. A Medicare Advantage open enrollment period. If you have a Medicare Advantage plan and you want to switch to another Medicare Advantage plan, you can do that between January 1st and March 31st. You cannot switch from original Medicare to a Medicare Advantage plan, and you cannot join a prescription drug plan if you have original Medicare. So it's really focused on people who have Medicare Advantage plans, either switching to another Medicare Advantage plan or going back to original Medicare and signing up for a prescription drug plan. Okay. You cannot join a prescription drug plan if you have original Medicare and you just thought, I'm going to wait. I'll enroll in Part D during the Medicare open enrollment period. You can't do that. Okay. And you cannot switch from one Medicare prescription drug plan to another if you're on original Medicare. So very limited what you can do during a Medicare open enrollment period. Okay, your initial enrollment period, a beneficiary can enroll 3 months prior to their 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. This is called your IEP, or initial enrollment period. So you're getting ready to turn 65. 3 months before you turn 65, you can enroll. You can enroll the month that you turn 65, and 3 months following your 65th birthday. Okay. If you miss this 7 month period, the next time that you can enroll in Medicare will be in what's called a general enrollment period. And sadly, you will face late enrollment penalties. So it's important that you sign up when you're first eligible. Again, unless you continue to work. Okay, the general enrollment period, you can enroll in Part B for the first time if you missed your initial enrollment period and do not qualify for a special enrollment period. Late enrollment penalties will apply, and coverage will begin the first day of the month after you enroll. So if you miss your initial enrollment period, you enroll January of the following year, your Medicare would start for example, in February of that year. Okay, Aging and Adult Services offers what's called a Medicare S.H.I.P program. We provide Medicare counseling. Ann Schmidt is the Medicare option supervisor. She's my direct supervisor, and I am one of the Medicare option coordinators. We do have volunteers who are also Medicare option coordinators, but I'm the only merit full-time option coordinator at this time. So what is S.H.I.P? S.H.I.P, again, it's the Senior Health Insurance Program, and we provide free Medicare counseling to individuals who are new to Medicare and those who currently have Medicare and want to explore their options. Okay, so if you have Medicare and you want to look around at different plans, you can call us. We'll help you do plan comparisons. We will look at your prescription medications and make sure you find a plan that covers your drugs, prescription drugs. And so again, this is all provided at no cost. Okay, questions?
I just had one more of a clarification. When you're talking about that 7 month window,
Okay.
right, like 65 before, after, that's only if you are retired, but if you keep working past your 65th birthday, does that fall on the birthday that you retire, or is that you just have to, if it's past 65, you just have to wait until the open enrollment period?
So if you plan on continuing to work when you turn 65, what you will want to do, so again, you have that 7 month period, the 3 months prior, the month of your birthday, and 3 months after. If you plan on, if your intent is to continue working, you will want to contact the Social Security Administration and let them know that you want to enroll in Part A. Now, the reason you want to do that is because Part A is free, right? For most people who have sufficient work credits, they don't pay for Part A. So you can enroll in Part A, and then you'll let Social Security know that you're going to continue to work for, X amount of years, and you want to delay your enrollment in Part B, as in Bravo, and Part D. And you let them know that you're going to have health insurance through your employer, and they will not enroll you in Part B and Part D. Now, when you actually retire, whatever that retirement date is, when your coverage ends, you need to contact Social Security, I would say even a month or two prior to your group health plan ending. You're going to want to contact Social Security and say, hey, I'm going to be retiring on this date. I need to enroll in Part B and in Part D. You're going to have a special enrollment period. Once that coverage ends, you're going to have 8 months to get enrolled in Part B and 63 days to enroll in Part D. But you need to communicate with the Social Security Administration, and they're going to ask you for proof that you had insurance. And your employer, before you leave, should give you a letter indicating that you had credible coverage with them, and you would provide that to Social Security, who would then go ahead and enroll you in Part B without any late enrollment penalties. So it's important that you enroll in Part A, but also notify Social Security of your intent to continue working, and ask them to delay your Part B and Part D until you retire.
And does that same thing apply for Medicare Advantage, or would I have to first get into original Medicare and then later go into the Advantage plan?
So unfortunately, you can't enroll in a Medicare Advantage plan until you're enrolled in Part A and B.
Okay.
So if you're working, enroll in Part A, you'll have what's just original Medicare. When you enroll in Part B, that's when you're then eligible for a Medicare Advantage plan.
Okay, great. Thank you so much.
You're welcome. Any other questions?
I
I
have
don't
to
see-
say, I have so much respect for all you have to have in your brain for Medicare.
Trust me, for the first 3 months, I was telling my husband, I'm like, I don't think I can fit anything else in.
That's a lot.
It's a lot.
It would be real, I mean, and I just think the Medicare counseling that is available to our older adults for free is just phenomenal. And
Yes.
I tell everyone I know, because I just learned about it this past year, and every older adult I tell, I'm like, hey, they have this wonderful thing. So I think you provide a invaluable service. So
Oh, thank you. Thank you.
Hey, Janet has a question. If you want to unmute yourself, Janet, you can just ask Deborah directly.
Okay, and I think what I need to do is call that program to get more in-depth help with this. I'm the one that asked about the Part D because I'm a little
Okay.
confused with all the different plans. But
Okay.
so to be honest, I can't get the special help. I'm going off of, because of the pandemic, the Medicaid. I had both before because I have
Oh, I
assets
see.
just a little bit above what they're supposed to be. So I'm
Mhm.
kind of stuck. And so I'm looking at those zero plans because I really can't afford to pay for a plan. And so
I see.
are these zero plan? I mean, are they worse or whatever, or they're just more higher? Do you pay higher out of pocket? Because I guess it's if you're sick, you'd pay out of pocket. I'm kind of gambling there, but I just feel like the monthly thing, I can't stretch
Yes.
myself any further. It
Right.
put a lot of stress on me.
So that you bring up a really good point, Janet. And when I'm doing Medicare counseling, this really is the dilemma that people are faced with. So just really quickly, so when you're on original Medicare, you have your Part B premium, your Part D premium, and then you also have, and I would not recommend original Medicare without a Medigap plan. I absolutely would not recommend that, just because there's no yearly limit on what you can pay out of pocket. And there's that 80/20 co-insurance, right? That can get really expensive. And without a Medigap plan, it's just, to me, it's not feasible, right? For people to pay the large amount, especially if you have a hospitalization. So what I tell people, think of it like this. Do you want to pay, for example, $360 every month on original Medicare, whether you see a doctor or not, right? Those premiums, you pay them whether you access care or not, right? But when you need to access the care, you know that Medigap plan is going to cover those expenses that are not paid by Medicare, right? But for a lot of people, coming up with that amount of money each month is very difficult. On a Medicare Advantage plan, however, there's lower out-of-pocket cost, but you pay when you access the care, right? And some of the disadvantages of a Medicare Advantage plan, you may have a copayment of $300 for an MRI, right? So maybe, you just pay your Part B premium when you go to, I mean, each month, your Part B premium, and maybe you don't go to the doctors for 6 months. So you're not paying anything out, right, except for your Part B premium. But when you go to the doctor, let's say that he recommends an MRI, could be $300. Then let's say that you have an outpatient surgery. There could be, I don't know, that could be $2,000, right? The good news is that you will have a maximum out-of-pocket cost on the Medicare Advantage plans, but as you access care, you have to pay for it at that time, right? So it's not like original Medicare, you pay up front, you kind of don't worry about it. On a Medicare Advantage plan, you pay as you go. You have lower monthly cost, but the co-payments can be really, really steep on some of the care.
Okay.
Right. And we can certainly talk about it, Janet. There are a lot of Medicare Advantage plans that have zero premium cost and also no health deductible. So I feel confident I could find you a fairly good plan, but with the understanding that you've got to realize that when you access the care, there's going to be co-payments. And if you have a hospitalization, you can hit that maximum out of pocket really quickly of $6,000 or whatever it is, $6,700. That's going to be your responsibility if you have something catastrophic happen
Yeah, I know it's
during
such
the
a
year.
kind of a gamble. It's kind of like it's really
Yes.
hard. It's like yeah, yeah. Anyway, but thank you for all the information. I appreciate it.
You're welcome. And if you feel free to give me a call, I'm happy to go over and some different plans with you. And I think we could find one for you that would be a good fit.
Okay, great. Thank you. Do
Okay.
you have your number? Do you have your number?
Oh, you know what? I'm sorry I didn't put it on here, but yeah, I can give you, you would just contact our outreach and they do the scheduling, or do intake and then they'll forward the referral to me. But it's just, area code 385-468-3200.
Okay, great. Thank you very much.
You're welcome.
Thank you, Deborah, for spending the hour with us, going over
You're
Medicare.
welcome.
It was so informative, and I'm not even in the ballpark to deal with this, and I'm taking notes, so that's great. Thank you so much.
Great. You're
Just want
welcome.
to mention that next month's webinar, we are going to be talking to Teresa from the Goodwin Company, who is the founder of the Stronger Memory Workshops, which Salt Lake County is going to start providing at the senior centers in 2024. So if you want to learn more about what Stronger Memory is and where they'll be provided, we encourage you to attend next month on the 14th, Tuesday at 2 p.m. Thanks, everyone.